Hello, everyone. Today we are going to be talking about central nervous system depressants, sedative hypnotics, and alcohol. So before we get started, I just want to let folks know that some of these substances are no longer used in medicine, and we typically don't. Or let me take that back. We may see this type of abuse, but not as common. Obviously, alcohol is one of the most commonly abused substances, but the other ones we're going to talk about, the other depressants, you may not see very often in the field, but we'll talk about that. So we're talking about alcohol, barbiturates, and let me go back a little bit. So when we talk about the central nervous system, if you haven't already read the chapter, please do. This is a very important chapter. And the CNS includes the brain and the spinal cord, which most substances are going to act in this space, right? They are going to affect the brain. And depressants are especially dangerous. So while we might not see them very often, with the exception of alcohol, it is important that we talk about this, okay? Barbiturates are typically phased out, if you will. You might see them in one of two cases, and you might see some abuse, but typically this is used in alcohol withdrawal. So we use a barbiturate called phenobarbital to avoid seizures during alcohol withdrawal, okay? Also, there's a specific barbiturate mixed with caffeine and Tylenol that is good for migraine headaches, tension headaches, or headaches that occur after a spinal tap surgery, okay? Benzodiazepines, these are very commonly abused these days. So this is the Valium, Xanax, Klonopin, Ativan, those types of medications. Opioids, we're going to go more into next week as a narcotic, but they do depress the central nervous system, and we'll talk a little bit about that today, but we'll save most of that conversation for next week. Tranquilizers, we used to use these a lot, especially in psychiatry, and we do still use them, but again, not as common. Hypnotics, which are kind of the first phase to sedatives, they're a little bit more dangerous. An example of that might be common to you is Ambien. And then we'll go more into sedatives, which are to induce sleep, anesthesia, that kind of thing. So when we use or abuse central nervous system depressants, we tend to get this sense of fatigue, lethargy, this kind of heaviness, anything that comes with being drunk, which I'm sure folks are familiar with. Those types of symptoms are going to potentially be present. Also, restlessness, agitation, euphoria. So sometimes we get the reverse effect where instead of calming us, it's actually stimulating us at high doses, okay? And then it will kind of come back down. A lot of CNS depressants are known as all-arounders, okay? Especially alcohol. So alcohol can make us feel calm or stimulated depending on our social situation, what we're drinking, what kind of experience we have with alcohol, and then it can do the opposite. So if anybody's ever drank a lot and then went to sleep, you'll know sometimes you wake up at like 3 a.m, very, very stimulated, very much awake. And this is because this substance is considered an all-arounder. So it can be stimulating and depressing at different peaks in the experience. We also see shallow breathing. So abuse of CNS depressants can lead to death. So again, going back to how serious the abuse of these substances are, you don't see it very often with the exception of alcohol and benzos, but it is very dangerous. Sometimes severe symptoms, we see reduced heart rate, which again, these will lead to death, or could lead to death, excuse me. Extreme confusion or memory loss. Digestive issues, poor judgment, blue lips or fingertips, clammy, cold skin, We can also see those sudden and intense mood swings that I just described, and very slow reflexes. So driving, operating machinery can be dangerous. So the same drug can cause different effects depending on the dose, and we kind of unpacked this a few slides ago. But typically in a low dose, they can relieve anxiety, promote relaxation, okay, maybe even induce sleep. Whereas in higher doses, we see that they cause drowsiness and definitely promote sleep. Even on a low dose, I wouldn't recommend operating machinery or vehicles. And in higher doses, we see this is what we would use for anesthesia during surgery. Okay. So types of CNS depressants. Benzos are a commonly abused substance, especially when I've seen this a lot in co-occurring with opioid abuse. Okay, so the mixing of the two, which is very, very dangerous. Working in the field in medication-assisted treatment, so working with folks who were also receiving methadone or Suboxone, I saw a lot of benzodiazepine abuse there. And I've lost a lot of patients to this, okay? It's not uncommon. From what I understand, it really, it's a great escape, like most substances are, but it really has this numbing, kind of euphoric effect. And just a fun fact, abuse of benzos for 6 months or more has shown in studies to increase the risk of dementia or Alzheimer's-like disease by about 50%. Okay, benzos are very, very dangerous. They are also one of the major substances where death can occur in withdrawal. So alcohol, benzodiazepines, and sometimes, very rarely, but sometimes heroin can cause death and withdrawal. Benzos are not something to mess around with. You do need to have, if you're going to stop using them, you do need to be in a hospital-based detox, or at the very least being tapered by a doctor. Tapered meaning having your dosage reduced over time safely. So some of the medicinal uses: relief from anxiety. So typically these are meant to be used in the short term. So if we have some type of adjustment disorder or some type of grief, if you will, or we have some type of acute trauma, using benzos for a short amount of time can be helpful. Okay. Sometimes, very rarely, and I would say at my work, working in mental health, we probably prescribe long-term benzos maybe 1 out of 100 times, right? So there's some people that the benefit outweighs the risk, but for most people, we are not going to prescribe benzos for very long. Sometimes folks get these before some kind of procedure where you need to relax. I know that I was given a low dose of benzos during a dental procedure recently. It can also treat convulsive disorders, so seizures, can induce sleep, relief from withdrawal symptoms. So we used to use this a lot in the management of opioid withdrawal. Okay. So we're going to go into GABA, which is the neurotransmitter that's primarily affected by CNS depressants here in a few minutes. But that is the neuronal receptors that are acted on here. We learned a little bit more about that last week. So benzos used to be considered, back in the 40s, 50s, 60s, mommy's little helpers. So many, many women were being prescribed these during that time. We didn't know then what we know now about the dangers of benzodiazepines. But what we do know is that, we're not going to go too far into this now, but culturally, excuse me, women during that time period were meant to be seen and not heard. And again, there is a cultural component to this where it makes sense that we would want that doctors would be focused on keeping women happy, quiet, kind of withdrawn during that period. Excuse me. Okay. So the side effects can be drowsiness, confusion, impaired coordination, tolerance, dependence, withdrawal, and abuse. So we talked about this. So barbiturates, which we'll go into in a second, are kind of like the first stage of benzodiazepines. And then we realize that those are really dangerous. So we come out with the second class of CNS depressants that kind of did the same or similar-ish things. Just to give you a little bit of perspective, even in the 70s, there were 100 million prescriptions written for benzodiazepines, and 50% of those prescriptions, twice as many of those prescriptions were given to women rather than men. Keep in mind, too, when we talked about the scheduling of drugs last week, marijuana, which is not completely safe, but relatively safe in comparison to benzodiazepines, is considered a Schedule I drug, meaning, as well as psilocybin, which we now know for sure is helpful for many, many things, are Schedule I substances. So saying that there's no medicinal purposes, there's no benefit to these substances, if you will, but something as dangerous as benzodiazepines is considered a Schedule V, which is relatively safe, and that's not true. So back to that conversation about like the scheduling of drugs and societally how that was done and how it's completely inaccurate. So again, barbiturates that we are going to see in the current modern times are the phenobarbital, which is going to be used for alcohol withdrawal, and then what we call Fioricet, which is that caffeine, amphetamine, barbiturate kind of compound that is for severe migraines and tension headaches. So some drugs that kind of seem like CNS depressants, but they are CNS depressants to some degree, but not as severe as barbiturates, are antihistamines. So these are medications that you would take for allergies, Benadryl type drugs, propofol, which is an anesthetic that is sometimes abused and sometimes used as a date rape substance. Date rape, and I use that term because that's the term that's commonly used. And on college campuses, we see this a lot, where folks are given substances in their drinks or maybe even sometimes in their food, and then that causes severe fatigue, loss of motor control, and then primarily to be assaulted. GHB is also considered one of those substances, and I have worked with folks who abuse GHB. It's not very common. More so you would see this in a college-like culture where it's being used to assault women. So GABA, you're going to read a little bit more about this in your book, but this is the neurotransmitter that causes inhibitory functions. So again, it slows or decreases activity in certain brain regions, including the limbic system, which alters our mood. It can also work on our blood pressure and our heart rate and our temperature. Okay. And then the motor cortex, which relaxes our muscles, relieves tension. So aside from death being a reality, of the abuse of CNS depressants. It can cause problems with thought, memory, and judgment, sometimes permanently, such as the case with the abuse of benzodiazepines, disorientation and confusion, muscle weakness, loss of coordination. So again, if we have folks who are abusing or taking CNS depressants, driving on the road or operating machinery, this can be dangerous. Slurred speech. It can also cause pretty substantial and disruptive personality changes. And again, these might be short term, they could be long term, and they could be permanent. Okay. And a lot of times we see combination use. So we see this mixed with alcohol or opiates or marijuana, and that is extremely dangerous. So folks who are more likely to abuse CNS depressants are those who use drugs to relieve stress, which is one of the motivating factors for many folks who use substances. The folks who want to feel euphoria and stimulation from depressants, so we talked about that and how alcohol causes that. Uses depressants to counteract the unpleasant effects of other drugs. So sometimes you will see the use of depressants after a hallucinogen like LSD to kind of come down from that, or stimulants such as cocaine or meth. But up for a couple days, finally want to get some sleep, you might see the use of CNS depressants. Okay. So the withdrawal from depressants, such as we talked about with benzos, can be deadly and very unpleasant. So typically, this is one of those weird ones where we actually treat withdrawal symptoms with another CNS depressant. So example, for alcohol withdrawal, we either give Librium or phenobarbital or both. So Librium is a long-acting benzodiazepine. Okay. If we are detoxing from benzodiazepine, typically you see folks go on a taper where they kind of decrease their use over time. Again, also potentially with some phenobarbital to avoid symptoms. Other substances we don't see very often, but I think, and I might be wrong, I think Librium and phenobarbital are primarily used in CNS depressant withdrawal. Excuse me. And now moving into alcohol. So despite alcohol being the most societally acceptable substance and most widely used and widely available, you can get it in damn near any restaurant that you go in, many stores that we go into. It is the most dangerous substance on the planet. The body responds to alcohol as poison. The body kind of tenses up and prepares itself, acts as if it's being poisoned. Alcohol is not good for us. I apologize if you hear my dogs. It is the most widely consumed drug in the world, and for some is as much of a part of life as eating. In some parts of the world, including some folks here in the US, drinking every day. Excuse me. I'm sorry, my dogs just ran in. Okay. So, of the 2 million people receiving treatment for substance abuse, more than half of them are being treated for alcoholism. Okay. Many folks, and I'm sure you've heard this before, refer to alcohol as a social lubricant. Okay. It reduces anxiety in social situations. Hi, girls. You need to go. Can you go? I'm sorry, my dogs are very cute, and they're all over me. Girls, I need you to go. Okay, get. Okay, sorry about that. So many people don't even view alcohol as an abused substance or something that's um, maladaptive, if you will, because it's so common in our society. It's legal. You see it a lot. I think my little sister really liked, what's that show called? The Vampire Diaries, which, as far as I know, is a show primarily viewed by teens. And I swear, in almost every single scene, they are drinking alcohol, which is fine. It's just like promoting this idea that drinking is classy and normal, and maybe for some of us it is, but it's very dangerous. The alcohol industry, which we talked about in week 1 or 2 of this course, is tremendous, billion-dollar industry. Also, it's just kind of embedded in our culture, right? So there are, on average, and this was in 2018, so especially during the age of COVID, this number might be much higher. We see 100,000 deaths per year associated with alcohol. So this includes direct alcohol-related death, right? So either from withdrawal or acute intoxication. But also included in this number includes, death by motor vehicle accident in which alcohol is involved. Okay. It also tends to disrupt personal, family, social, and professional functioning. So it's one of those substances that many people, we call them functioning alcoholics, can do very well for a long time, but frequently we see this turnaround happen eventually, where you just can't keep up with it anymore. The consumption and overconsumption by college students causes approximately 2,000 deaths per year, which is substantial. And just a fun fact, I forget the number exactly. I think it might be in your book. But many college students meet criteria for alcohol use disorder while they're in college, but more often than not, they lose that title once they graduate and start families. And so more often than not, even if you are a binge drinker in college, you won't be an alcoholic later on. Okay. Nearly half of all Americans will be involved in some type of alcohol-related traffic accident at some time during their lives. So whether that means being hit by a drunk driver or driving intoxicated, nearly half of us will be involved in some way, shape, or form. Also, it is said that more than 2% of nighttime drivers have a blood alcohol level that exceeds legal amounts, which is 0.08 in many states. I think it's 0% in Oregon, if I'm not mistaken. Fetal alcohol syndrome is something we're going to unpack in a second. So this is when pregnant women use alcohol while babies in utero. Alcohol is the second leading cause of premature death in America, and this has many, many causes. Severe alcohol dependence typically is paired with poor diet, not going to the doctor, not taking care of self. So while the alcohol directly is an issue, it's also kind of the lifestyle that comes along with it. Okay. So about 250 billion per year is spent dealing with the social and health problems related to alcohol use. Give me 1 second here. Okay, so um, alcohol is very degenerative, if you will. Okay, so the actual contact that it has with the body in the mouth, the esophagus, stomach, intestines, so anywhere the alcohol would go and flow through, can be negatively affected by alcohol. Okay, and this includes the microbiome, so the belly, and we'll talk about that in a second. It influences every organ in the system. So alcohol is going to impact the kidney function, liver function, brain function. Um, it's so detrimental, and you'll read more about this in your book. The effects on the human body depend on the blood alcohol content. So what we're drinking, how much we're drinking, if we had food in our body prior to drinking, what kind of health risks we have. There's a lot of things. Also, one of the it's not funny, but one of the interesting things about alcohol is what we call reverse tolerance. So this is one of the only substances where you can drink for a long time, have a very high tolerance, and then all of a sudden it reverses, and you can only have small amounts of alcohol that get you intoxicated, and this is because of severe impacts on the liver. So we talked about this, how blood alcohol content, what that's dependent upon. Also, alcoholic beverages are empty, so they have no vitamins, there's no minerals, there's no protein. It's just carbs and calories. Okay. So, this is kind of the flow of alcohol, if you will. So going in through the mouth, moves to the stomach, the intestines, the bloodstream, the liver, and the brain. Okay. And a lot of times what happens is folks drink so much that the liver doesn't have time to process, and that's where you see drunkenness or alcohol poisoning. Okay. Drinking too much too fast. So polysubstance use. So many people use alcohol concurrently with other drugs, many times cigarettes, but also opiates. Marijuana is a very common one. Okay. Alcohol can also potentiate, so exacerbate the effects of other CNS depressants like benzos or Ambien. Okay. It decreases the amount of an expensive and difficult to get drug. So mixing alcohol with cocaine or mixing alcohol with heroin can also, the alcohol can potentiate that substance. Okay. So the effects of alcohol, I'm sure many of us have been under the influence of alcohol at one point in our lives. If not, that's wonderful. I can tell you that your body will thank you. But in low to moderate doses, we see kind of disinhibition. So what that means is kind of not so serious maybe about, I guess for some of us, morals and values, or we're not thinking clearly. Okay. Who we're with, where we are, may help determine our response. For some of us, it'll make us more social, euphoric, and friendly. For some of us, it's the opposite. And different types of alcohol can also have this effect. I know in my family, brown types of liquor, such as whiskey, would make my father very aggressive and hostile. Okay, but other forms of alcohol, it wasn't the case. So it kind of depends on the person, what you're drinking. Can certainly interfere with motor activity, reflexes, and coordination. Driving is very dangerous under the influence of alcohol. In slightly higher quantities, we see increased heart rate, lowered blood pressure, could stimulate appetite, increase urine output. Okay, it enlarges the blood vessels. Okay, so we can start to really feel the effects of alcohol at this point. And at higher doses, this can cause nausea, vomiting. Typically, the social setting stops having influence on its effects, and you're just kind of gone, if you will. Thought process can certainly be impacted, induces drowsiness, causes sleep, can also cause a hangover when the drinking stops. Okay. Excuse me for 1 second. Okay. So when large amounts are consumed rapidly, so we talked about the liver not being able to process this alcohol, we can see severe depression of the brain system and other motor control. It can actually cause death. Typically, a lethal level of blood alcohol content, is between 0.4 and 0.6 volume. Okay. People can go into what's called a stupor, anesthesia, coma, or death. I also remember friends in high school drinking a lot and being unable to wake them, like they're still breathing, they're still alive. We call this alcohol poisoning. Okay. So long-term effects of alcohol, so chronic alcohol use can have some major effects, some of them permanent, especially if continuing alcohol is something, it's kind of, could be similar to cigarettes. Of course, quitting alcohol at any stage in the game is going to be helpful, quitting alcohol safely, but we could have some lingering effects. So it could cause mental disorders, depression, anxiety. Of course, there's going to be other factors here, but it can certainly increase the risk. We also see Wernicke-Korsakoff syndrome. So this is a term we don't use anymore, but you might be familiar with, is called wet brain. Okay, so this is when we see confusion, language is affected, and this is whether you're under the influence of alcohol or not. See some rapid eye movements during awake time. Just a lot of cognitive challenges in these folks. If you're unfamiliar, you can look it up on YouTube and kind of see what that looks like. But once you see it, it's pretty easily identifiable. The liver, so we can have toxicity to the liver, including what we call alcoholic hepatitis and cirrhosis. So this is kind of the liver develops scar tissue. It's unable to process food or beverage, including alcohol, properly. We see the microbiome, so the bacteria that is needed to digest and to function in the belly. It decreases tremendously. Okay. We also see cancer, so that deterioration of the esophagus and the throat through alcohol, primarily hard liquor type of alcohol. We see that deterioration. Kidneys no longer function properly, they're no longer filtering. Hypertension and stroke is very common in folks who abuse alcohol. We also see sexual functioning being affected. So this could be ED, erectile dysfunction. We can see the reduction of testosterone or estrogen, which could disrupt the menstrual cycle and the reproductive functioning. Okay. We can also see a hormonal imbalance and immune dysfunction, so much more likely to get sick. Okay. And that can be permanent. Alcohol and pregnancy. So let's just go here real quick. There is no safe level of alcohol that has been established for pregnant women. I know years ago I heard drinking wine, a glass of wine every night or frequently during pregnancy is safe. No, it is not. We don't know that for sure. So my recommendation would be, if you're pregnant, please, please, please stay away from alcohol. And the risk is it's just not worth the risk. One of the things that we see in moderate, so drinking a glass of wine every night would be moderate use, okay, or most nights, to excessive drinking during pregnancy can and frequently does result in miscarriage, stillbirth, premature birth, fetal alcohol syndrome, which is a syndrome that is going to affect someone across the lifespan. There's a lot of new information coming out about this. They say the damage is dose related. So again, the more alcohol that you consume, the more likely you are to, or your baby is to, experience the following. They tend to look different, right? So head smaller, flat face, narrower eye openings, eyes closer together. And we see this more so as the child ages. We see growth problems. So they're born smaller, they may be smaller over the lifetime. Lots of learning, behavioral problems, cognitive defects, birth defects. And then also we see impacts on attachment, and folks with fetal alcohol syndrome are more likely to abuse alcohol in the future. So roughly 12.5 million folks with alcohol use disorders in the US right now. So again, this information was taken in 2018, so that number very well may have changed. About 1/4 of high school students currently engage in alcohol use. It is said, and I don't know that this is true, but it's just something to think about. Folks in recovery from alcohol are more likely to relapse under stress. And recovery from alcoholism is a long-term, sometimes a lifetime process. And we'll talk more about recovery later on in the class. So there is medication-assisted treatment available for severe alcohol dependence. So sometimes we use naltrexone, which is also used in opioid treatment. So this can help relieve cravings, okay? Antabuse is still pretty popular, so it makes alcohol very unpleasant. I've heard from folks that drinking alcohol, it kind of like makes you allergic to alcohol, is how it was described to me. Causes you to turn red, maybe get a rash over the entire body. Also can feel like your head's in a vice grip, right? So your head's being squeezed really tight. And then we have Campril, which reduces withdrawal symptoms and helps to restore hormonal and neurotransmittal balance in the brain. Okay. Most often, I would say naltrexone is the prescription of choice. So as we talked about in the near science part of this class, I think in week 3, epigenetics certainly plays a role. Okay, so our genetics is not going to determine whether we become addicted to substances or not in and of itself. It is a variable that can certainly increase the likelihood. But we do have gene expression that can contribute to the, how do you say, how alcohol affects us, how much we can drink, how much we like alcohol, if we're negatively affected by alcohol, that type of thing. So alcohol withdrawal, and you're going to read about this in depth in your book, and I highly recommend not missing this piece because this is going to be important. You are going to come across this in the field. So for the first week, primarily what you're going to see is anxiety, insomnia, fever, restlessness, nausea, tremors, agitation, instability, confusion, disorientation, paranoia, and maybe even hallucinations. Alcohol withdrawal can be deadly, and in about 10% of people you have serious withdrawal symptoms such as fever, hypertension, hyperthermia, increased heart rate and pulse, seizure, and those tremors. Okay. So depending upon the level of alcohol, what you're drinking, how much you're drinking, primarily folks are going to need to go into a medical detox. Okay. When we get into the second week, typically we are tapering off medications such as Librium or phenobarbital, and we know that folks are going to live, if you will, but the withdrawal symptoms can still be pretty substantial: anxiety, shakiness, depression, mood swings, nightmares, and brain fog. Okay, and this can last for a while. We talked about post-acute withdrawal in one of our sessions, and I posted some information on that. So post-acute withdrawal can last up to a year, maybe even longer, depending on the substance. And we see increased anxiety and depression, sleep disorders, mood disorders, decreased sexual interest, and decreased energy. Okay, so this is the brain trying to find its balance again. And that is it for today. Please let me know if you have any questions. Please make sure, I know that there's a lot of reading this week. If anything, please make sure that you're paying attention to the alcohol chapters. If you can't read them, at the very least skim them, watch some of the videos from this week, because alcohol is going to be something that you see a lot of in the field. Okay.